Fibromyalgia treatment success secret number 14, adrenal glands. Your adrenal glands make a hormone called cortisol. They sit on top of your kidneys and they're your stress glands. They make lots of hormones for your body in addition to cortisol, such as aldosterone and your androgens. Your adrenal glands are vital for optimal health. When your adrenal glands are not working, it causes high levels of cortisol in your system. And this is why you still have symptoms, especially insomnia or difficulty sleeping, even when your other lab tests may look normal. Cortisol is one of the main factors that regulate your blood sugar levels, not insulin. Everybody thinks it's insulin, but actually it's cortisol. When cortisol is released by your adrenal glands, it's accompanied by cytokines. Now, cytokines, they suppress the ability of your pituitary gland and your hypothalamus up in your brain to make thyroid-stimulating hormone. So your adrenal glands make cortisol in response to a stress, whether it's physical, chemical, or emotional stress. And cortisol also promotes inflammation, which makes your adrenal glands pump out more cortisol. As cortisol is released, the cytokines come out along with it, and that suppresses your pituitary. There are common causes of elevated cortisol, some of them being chronic stress, post-traumatic stress disorder, or hidden gut infections. You'd be surprised how many patients I've had that have come in here with parasitic infections. Other causes of elevated cortisol include blood sugar dysregulation, which is hypo or hyperglycemia, and diabetes and insulin resistance. You need to make sure that your blood sugar level is stable. And you need to understand that when you have these problems, whether your blood sugar level is going up or down, your cortisol it's going to affect your cortisol levels, and it's going to increase your cytokines, which is going to also affect your pituitary and then your thyroid. Then you're going to start getting symptoms such as fatigue, pain, cold hands and feet, insomnia, inability to lose weight, depression. Your hair can fall out. Remember, there are several types of blood sugar problems, not just diabetes. All of this needs to be checked. The other thing about cortisol is when your body produces high levels of cortisol, it also makes your body, your pain fibers, more sensitive, which means you're going to feel more pain all over your body. So you've got to be aware of what your cortisol levels are. In our office, we run tests on what your cortisol level is. So most of the time, if you go to your doctor, they take one snapshot, they'll take a blood test and say, where's your cortisol level so that we know how your adrenals are? And they look at it and they go, well, it's a little low, but you know, it's normal. It's not normal. You need to have a test done where they take a snapshot during the course of the entire day. We look at it at 8 a.m. in the morning. We look at it at noon. We look at it at 4 p.m. and we look at it at 8 p.m. You see, because your cortisol level should start high and then decrease over the course of the day. And it's in an inverse relationship to melatonin. You can only do this test, it's a saliva hormone test to measure your cortisol levels. If you're not getting these tests done, you have no idea how your function is. So call our office. We'll work with you. Ask for our $67 fibromyalgia examination and 2 treatment visits. I'm looking forward to helping you. My name's Dr. Keith Lynch. Call today.